right, I think we can go ahead and get started. Hello and welcome everyone to Women's Health Tech Wednesdays. My name is Nina Joshi, and today we will be bringing on a very special guest from the HITLAB family, Kat Marriott, who is the Senior Research Scientist at HITLAB. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Kat during our conversation, please feel free to add them to the Q&A feature at the bottom of your screen, and I'll make sure that we get to it during our talk today. So with that, I'd like to formally bring on Kat. Hi, Kat. Thanks for joining us today.
Hello. Thank you.
I am very excited that you're here today. And of course, to kick things off on this show, we love to ask, what does women's health tech mean to you?
So to me personally, women's health tech really means an opportunity to make an important and a valuable impact in women's health in general. As a scientist, I know that there's been a lot of time and a lot of space, a lot of areas where women's health issues have really been neglected, and also in recent times, not only neglected, but really politicized. And so women's health tech, especially at HITLAB, is an opportunity for me to really make a profound and important impact in women's health.
Absolutely. I love that. And I think you really do speak to the urgency almost of, this is something that has been happening, continues to happen. And, we're kind of getting more and more in a position to be able to do something drastic about it, which I think is really incredible.
Yes, that is absolutely right.
And, as your role, so you are a research scientist, would love if you could just tell us a little bit more, about yourself and kind of how you landed into a position like this.
Right. Okay. So I am a scientist by training. I have a PhD in pathology. So I've studied a lot of different diseases and infectious diseases and public health. Is my primary background. And I spent many years in industry conducting preclinical and clinical research projects, primarily in the infectious disease world, but in more general public health issues. And I spent many years in the private sector, and then moved more into scientific project management, and spent several years in academia, not only running scientific-based organizations, but also participating in public health-based research within academia around health and wellness issues. And during COVID, things in academia kind of changed a little bit, and I found myself working from home, and I decided that I was going to make a change, both personally and professionally. As a side note, I have I guess you could call it a side gig, but I am also the executive director of a nonprofit organization that addresses the opioid epidemic. That's a personal passion of mine, because I lost my sister to opioid overdose several years ago. But between running that organization and working in HITLAB, I'm really utilizing a lot of my both research and scientific project management experience, and kind of putting things together right now into a space that I find very rewarding.
I am speechless. Oh my gosh, what a robust, number one, career trajectory, and just everything that you're doing even right now with HITLAB and your nonprofit. I think that is absolutely incredible. I mean, this intersection, I would imagine, between public health and pathology, especially now, I think is so fascinating, and it must be really great to be able to have that lens in which you kind of see this space as a scientist. Definitely want to ask you questions about your nonprofit, because that just sounds extremely interesting. So I'm going to make a little note to myself to make sure I ask you some maybe towards the latter part of our discussion.
Okay.
Yeah, but so speaking kind of to HITLAB, kind of what you're doing there, would love if you could share with us a little bit more about, what your position entails at HITLAB, kind of doing the research arm, and kind of some of the goals when it comes to research and being able to, solve things or make an impact in healthcare using HITLAB.
Right. So the HITLAB research group, and so I'm a senior scientist and co-manager of the HITLAB research group, and we work with a variety of digital health tech organizations that come to HITLAB, both through women's health tech, but also through some of the other programs, the Breakthrough Alliance and BT1. There's a lot of different, I want to say, avenues for organizations to come into HITLAB. But the research group is really, really an important group within HITLAB, because we are working one-on-one with these organizations to really take a critical look at your health tech solution and answer the questions that are important to answer. And there are various stages at which answering these questions and getting this information, getting this data can be really critical. If we're talking about working with an organization at the very beginning of their development, we can do a lot of strategy research, do some landscape research, identify kind of what's already out there in the market. Where is there a niche or a need in this particular area? And then really hone in on what kind of solution would be best for not only for the market, but for the people utilizing that solution. 100%. And then for those organizations that are a little bit further on in their development, once they have a working product or service, we're answering questions like, is this product really working and doing what we truly wanted it to do? Is it serving the consumer appropriately? Are there other stakeholders? Are there physicians involved? Are we hitting all of the bases? And just even really seemingly minor things like, what's the user experience like? Are we confusing our users by having too many buttons or too many options in our service or the digital platform or whatever the product might be? So there's a lot of different areas of research where HITLAB is doing a lot of great and important work. And if you think about it, similar to developing a drug or a vaccine, it's very similar. You got to do the basic research and identify, okay, what are we trying to solve here? What are we trying to cure here? What are we trying to treat here? And then through the process, is this drug or this therapeutic, is it we don't want it to harm anybody in unintentionally, but also, is it really doing what it needs to be done? And have we covered all of the bases? And then you got to get it out there and actually sell it or market it or actually get it into the hands of the people that are using it. So, and at HITLAB, we do the same thing, but just with digital health products.
Gotcha. Wow. So it sounds like it's really kind of an end-to-end team where kind of regardless of where you fit, your company fits within the maturity, there's always kind of something that can be done from a research lens.
That's absolutely right. And we've worked with companies all across the entire spectrum, even, companies that have very mature products that are currently that are on the market now. How can we help tweak that product in order to either fit a slightly different need or to reach a slightly different market or we want to add a new feature to this platform or this product. Does it work right? Does it do what we wanted it to do? And the research process is really, really important, because there would be nothing more defeating than coming up with a really, really great idea to address a market need or a health need that is really, really critical and important. But once you get it out there, you find out that consumers just don't like it, or don't want to use it, or for whatever reason they're not using it. Or it could be that the patients or the consumers are using it, but it's not fitting in well with the clinicians or the other entities. Maybe it's a health insurance benefit situation. There's a whole host of reasons. There's a whole host of reasons why new technology and new products fail, and research can really help prevent some of that.
That is amazing. And I was actually just going to ask you to share a little bit more about the overarching why is research so important really in the product development pipeline and even beyond. And I think you already did a great job just kind of explaining the ethos beyond something like that. But would love to kind of maybe ask a little bit more. You had mentioned that, even companies that are, mature, have products in market, can benefit from research. And I love that you kind of alluded to this iterative approach of, research doesn't just stop. So would love if you could share, what is there an ideal timeline? Like, how often should companies be, going back out into the market, into customers, et cetera, to conduct research?
Well, I would say that's it would absolutely, it varies, just as digital health products can be very, vast and variable.
Right.
That's a difficult question to answer, because it really is dependent upon that product or that service. But I would say anytime that there is an important question that arises during the timeline, during either the development timeline or even the marketing timeline, is an appropriate time to stop and say, do we need an actual research project in order to answer this question? Sometimes that question is it's not strictly a research question, but there's any time when a question arises within a company's lifespan, then that's an appropriate time to stop and question and to see maybe research is needed at this point in time. And it could be something as simple as identifying, like I said, a new market segment, or just testing out, like I said, a new feature or a slightly a different platform. But even organizations, if they're updating software or the changing features, there's always beta testing that can and should go on with those products, and we can help out in all of those areas.
Wow, I love that. No, I think that makes a lot of sense. It's kind of, being able to just do a kind of a gut check or a temperature check every now and then to make sure if there is any type of change or pivot, to see if that is, something where research can help define or cement some of those aspects.
Yes.
That makes a lot of sense. Awesome. Would love if, we can maybe even do a deep dive into some of the research projects that you've worked on or are working on at HITLAB. Would love to kind of get some examples of all of the amazing things that this team can do.
Yeah. So we do at HITLAB, we do contracted research projects for a lot of organizations. And we also provide some research services specifically to our Women's Health Tech Challenge winners and our Breakthrough Alliance Challenge winners. And again, depending upon where they are in their lifespan, development process, we tailor our research project to what their needs are. But we've done a lot of work, especially with women's health tech, and everything from doing really deep dives into the market landscape for providing a new service, say whether it's in reproductive and like fertility options, or one of the big areas that we've been working a lot in is the mental health space, and women's mental health is absolutely a very important area. We've worked with several companies not only to help them answer their questions about the usability and acceptability of their product, addressing women's health needs, especially like postpartum depression is one of the biggest areas where women's mental health needs really needs some improvement and needs some gaps filled. But so one of the companies that we're working with right now, we're identifying some clinician experience data to help them get their product in the hands of the clinicians that then use their product to deliver to their patients and address their mental health needs. So like I said, there's a lot of different areas that we can address the research needs, but the usability, does the consumer like using this product? Are there things that they don't like about using this product? What is their level of engagement? Are there suggested changes or improvements to that product? And what are the positive outcomes of using that product for a period of time? All of those things can be answered in a well-designed usability study.
Absolutely. And I love that that's even, something that you're really thinking of, because at the end of the day, it can be effective, it can be safe, but if it's not being used and people don't like to use it, then, it's not going to have the desired impact. So I really love that you're also, your team prioritizes that as well, about the usability component of it. And I could just imagine from number one, just your academic experience and expertise, but all of the work that you've been doing at HITLAB with all of these companies, just kind of taking a step back, what are some of the trends that you're seeing within, the health tech industry? What are some areas of focus or things that we should be paying attention to?
So personally, I would say one of the biggest areas that has come up very, I'm going to say hot and heavy, is the issue of data privacy. And we're talking about these developing these digital health technologies that potentially are collecting a lot of personal data, not only about us, but they're connecting them to our medical records sometimes, or our medical conditions.
Right.
And health and data privacy is something that is coming up now really hot and heavy. Part of it, especially in the area of women's health tech, is coming up because of the recent Dobbs Supreme Court decision. And there's a lot of discussion, a lot of really good information coming out now about how important it is to protect that data, not only in collecting it, but storing it, sharing it, or versus not sharing it. And I think people are becoming more and more aware of the fact that as all of our lives become more digital, that, that information can be out there, and it can be very powerful in a good way. And it can also be very powerful in a negative way, and can be potentially used against us. And that's one of the biggest areas that I'm seeing a lot of discussion and a lot of new talks and seminars and webinars and conferences coming up about protecting data privacy.
That is such an important one that you brought up, because I think as both a consumer and as someone that works in healthcare, I 100% agree with you. I'm seeing it kind of on both sides. And it is one of those downstream effects of just increased digital reliance and connectivity. Your wearable can connect to your phone, which can connect to your health insurance app. So I think it's so interesting to see that being brought up. And I love that even as a consumer, there is more awareness. And I think this time has really kind of prompted consumers to ask those questions of, where is my data going? What's happening to it? So definitely a very hot topic for sure.
Yes.
That is amazing. I know we only have a couple of minutes, but I just wanted to ask, I'm so curious, especially with the work that you're doing kind of within the research space. I know that some of the examples that you were mentioning were kind of more direct to consumer, but for, some of the tools that are where the clinicians are the end users, have you seen any variances in behavior between, what usability looks like for a consumer versus what usability looks like for, a doctor or a nurse?
Yeah, and that is important. And some of the digital healthcare technologies and products that we are developing now, really there are two end users. It is a clinician of some sort, and it is also, it can also be a patient of some sort. And there absolutely is a distinction. There's, obviously not just in, what the service is providing, but the benefits that a clinician needs to gain from the utilization of this digital health technology are very different than what the benefits of a patient is going to want to see. And so we have to talk about, profitability and how does this increase, time efficiency, or how does it help me get reimbursed for my services better? Or how does it fit in with my clinical structure better than, the current non-digital standard? So there are definitely a lot of questions and a lot of areas that are very different when we're talking about a clinician user or a professional. Doesn't have to necessarily be a clinician. It could be a midwife or a nurse practitioner or whatever, versus a patient or a consumer. So there are a lot of differences. Clinicians and healthcare providers are getting more and more savvy. They're getting more and more interested in utilizing these digital health tools because they recognize that it can help them in not only help their patients, but help them do their job better.
Right.
And that's really important.
That is incredible. And I love that, when you think about technology, there are sometimes multiple end users. So it's really kind of balancing, making sure that all of them are kind of being accounted for. Also wanted to ask, I know you had mentioned, the research, kind of the pipeline for kind of engaging your team, how, if you go to HITLAB events and are challenge winners, how sometimes you can kind of get that as a perk. What are other ways, for folks on the call that have startups that are interested in utilizing HITLAB, how can they get in touch with your team to do some research with you all?
Yeah, so you go to the HITLAB website and we have a contact us there. And I think, I don't know, maybe Jerry could pop that into the chat, but reaching out to us and just even having a conversation about what kind of research options are available to you as an organization. Just having that basic conversation can be really, really valuable. And it's important. And we set up meetings to talk to organizations all the time, and sometimes they will come to us for their research needs. Sometimes it's a little delayed. They're like, okay, we know we have this research question that we need answered, but right now we're in the middle of fundraising. And so as soon as we get that taken care of, then we're going to come back to you. But having that as part of your development plan can be really, really interesting, really important. And having that conversation with us can be really interesting.
I love that. So almost even just being able to talk to you all as just like for brainstorming, ideation, kind of that thought leadership, just getting the conversation started. I love that that's kind of something that you all make sure to offer. Awesome.
Yes.
That is incredible. I know we have a few minutes, so we have to, of course, kind of end our conversation with our favorite question, which is, what are some lessons learned from your career? So any words of wisdom that you can share with us, whether that is just something that you have uncovered through experience, or if you were given some words of wisdom from your mentors that you want to then pass forward to us all.
Oh, absolutely. So I think the world of science and healthcare is changing drastically for women as consumers, but also for women as entrepreneurs and as scientists. And as a woman being trained and coming up in an area that, has really been heavily male dominated in terms of, my peers, my colleagues, it is so important to empower one another, to share, to mentor. And, there were so many times within my career where I looked around and didn't find a lot of female mentors or even just comrades. And, that is critical. That is absolutely critical, to make ourselves available to one another, to provide assistance, guidance, mentorship, share information in any way that we can, especially now in this world that, like I said, it's changing so rapidly. I envy some of the younger scientists coming up now, that they have so many more resources and so much more of a network of women to really to help them than I did at times in my career. And I definitely want to provide that to as many young scientists as I can.
That is absolutely incredible. Wholeheartedly agree. I think being able to build and continue to foster a community of support. And I think just, reassurance and validation sometimes is also all that's needed. Just knowing that there are people in your corner and that you're not alone can go such a long way. So I love that you called that out. That is amazing. Well, I wanted to thank you again, Kat, for such an enlightening conversation. Really, really appreciated your time today.
You're very welcome.
Right, awesome. Well, everyone, please be sure to tune in next week. We will be chatting with some folks from Novartis. We also wanted to let you know about our symposium that is happening at the end of this month. All of the registration information is in the chat. We also have a new podcast episode that's coming on, so please be sure to check that out. Wanted to give a huge thank you to our sponsors, Goodwin and Witham, as well as one last thank you to our guest, Kat. And I'll see you all next Wednesday. Bye, everyone.